Greetings and welcome to our weekly educational rounds here at Sinclair, where every Monday we attempt to provide a little bit of a topic that everyone can perhaps use in their life. And today, my name is Jim Ellermeyer, and I'm a behavioral health therapist here at Sinclair. And today I'm joined by my colleagues, and on my left would be...
I'm Ann Sommerfeld, and I'm a PA student with the University of Mount Union.
And on my right...
I'm Karen Krakovich. I'm a PA student at Seton Hill University.
And I thank everyone for joining us today. And it's our intention to provide some type of a useful message that you can carry on into your life. And of course, we always insist on having a little bit of humor here. Do we not, Ann?
Oh, yeah.
Yes, absolutely. So here at Sinclair, we absolutely insist on laughter because laughter is the language of recovery. It most certainly is. So today we're going to be talking a little bit about some of the enhancements that we can offer to people's lives. When people usually present, they come in for anxiety, they come in for depression, they come in for some type of a thing that's causing some dysfunction and some disruption in their life. And rather than paint that person into a box and use some type of fancy diagnosis or reach into our big bag of intellectual interventions, quite often what we do here at Sinclair, and Sinclair is a holistic integrative psychiatric facility where we look at the mind, body, and spirit of an individual. We look at everything that's going on in their life, everything that's going on in their environment. And quite often, we've often found that chemicals and pills are wonderful things, and when they're needed, they're needed. However, they can provide a base and a platform on which to grow from, a bridge to get from here to there. And quite often here at Sinclair, we try to eventually, if not eliminate, replace pills with skills. And one of the skills that we're going to talk about today is animal and pet therapy. And as many individuals present here with depression and or anxiety, one of the things that we often, in fact, we're training a therapy dog here at Sinclair. Her name is Kaya, and perhaps we'll have her on soon one day. So tell me what you, if you know anything about pet therapy, Miss Karen.
So pet therapy is starting to be a new way to deal with depression, anxiety, autism, and some childhood disorders like ADHD. Really the goal of it is to improve people's social, emotional, and cognitive functioning. Also, therapists who have therapy pets are seen as less threatening, and people are kind of easier at relating to their therapists when they have pets around.
Absolutely, and you've sat in with me a number of times now, Karen. Mm-hmm. Would you rather deal with a nice little puppy dog, or would you rather deal with Big Bad Me?
Well, I do like puppy
dogs. Great. And a few weeks ago, we presented a podcast on equine therapy, equine assisted therapy. Mm-hmm. In fact, our physician's assistant here is Sasha Alexander Zalesnik is involved in equine therapy. So it'd be awfully difficult to bring a horse in here. Do you think?
Yeah, it'd probably be hard to get through the door.
Yes. Or in your house. Or have you ever been to an assisted living home or a nursing home, Ann?
Mm-hmm.
Okay. And what do you sense there when you're with some of the folks there? What do they desperately want?
They kind of want companionship, I think. Even just social interaction would be important for them.
Sure, absolutely. And in your world, what have you found out about pet therapy, some of the uses that it's for?
One of the things that a lot of the research that I found was actually using like dogs, cats in like dementia patients, because it kind of gives them, like I stated before, that social interaction. It gives them something to care for, relaxing, and it can calm their agitation behaviors as well. So I saw a lot of research going into using that in dementia patients.
Well, sure. And some people, Karen, begin to feel unattached or that they have no purpose in their life. And certainly caring for a pet or an animal can certainly give one's purpose.
As well as companionship.
Absolutely. And there's much scientific research that goes on regarding the efficacy of pet and animal care, as it's been shown that simply stroking or petting a dog or a cat can lower blood pressure and lower heart rate, lower respiration, calm people. And you particularly mentioned, Ann, folks with dementia. And sometimes folks with dementia can get a bit agitated and get a little bit angry or act out. And this may be one of the ways that they can certainly do that. Do you have an animal?
I have 2 kittens.
You have 2 kittens.
Yeah.
Tell us about your 2 kittens. What are their names?
Gus and Ellie, and I also call them White Cat and Black Cat to make it a little bit easier.
Yes.
But I just love going home and seeing them. They always run and meet me at the door, and they sleep with me at night, so they're always there, and they'll follow me around, so it's nice to have someone always follow me around. And when I cook in the kitchen, they're always there meowing, trying to see what I'm doing. So it's just nice to always have kind of, even though it's an animal, someone there to spend my day with.
And as both of you know, here at Sinclair, our practice is centered around mindfulness. And what is more mindful than a cat? What do cats do when they're happy? What do they do? What kind of sounds do they make?
purr.
They purr. That's right. And do you think that the cat is worried about the mouse that got away yesterday?
No, probably not.
Do you think the cat is worried about the mouse that's tomorrow?
No.
No, absolutely. So, and again, as we often ask here at Sinclair, I'm going to ask you both, what time is it?
Right now.
Do you think cats know what time it is?
No.
Do you think they're in the now?
I think they're in and out. Yeah.
Absolutely. So they purr, they take care of themselves, and they're absolutely living in the moment. They're like what I call living outside the lines. And we were dealing with an individual the other day, and this individual talked about the intensity of life, the intensity, experiencing the intensity of reality. So we can't overestimate the value of tactile stimulation, Karen. Tactile stimulation. Words can only do so much. And it's very difficult to think our way into behavioral change, to think our way into a better way of living. So everyone out there can ask themselves, and everyone knows that, of course, that I'm in long-term recovery. And when I used to go, of course, I still attend. When I first attended my 12-step meetings, there would be these signs on the table that would say, think, think, think. And Karen and I would look at those and say, that's how I got here. So the idea is we act our way into other behaviors. We act our way into thinking right. So could you think of a few ways that having an animal around could help you with some type of behavioral change?
I think even just touching them, petting them, having that companionship, something to touch and feel is something that kind of relates you to other people, can help you interact with other people as well. Having just that contact with someone or something.
Absolutely, for sure. And when a person is suffering from depression, and they really don't feel like getting off the couch.
That's exactly right.
And maybe they don't even want to come out of their room. They don't want to interact with anybody. They don't want to talk with anybody. However, does an animal need to be fed?
Yes, it does.
The dogs need to be walked?
Oh, yeah.
So having these animals around can give someone a sense of purpose. And Karen, as you know, here at Sinclair, we try to build on small, achievable goals. Taking a dog for a walk. Perhaps a person who's a little bit hesitant about going outside by themselves may do so with their friend with them. With their friend with them. Do you have any animals, Ann?
I have a cat.
You have a cat. What's your cat's name?
Her name is Oreo.
Oreo. And an Oreo would be?
She's black and white.
She's black and white. How about that?
She's a mixture of mine.
Yes.
How about that? Wow. That might, your cats might see her and go completely bonkers, huh?
Yeah.
Wow. So tell us about Oreo.
Well, I have a little bit of a different relationship with my cat than Karen does with hers. She's really, really nice and sweet to everybody else, but to me, all she wants to do is play with me. She'll bite me. She'll hit me. I mean, it's totally playful, but it's not that same cuddly relationship, but I like it. I mean, I've had her since I was really little, so she's always kind of wanted to be very playful with me, and I enjoy it.
Well, wonderful. So do you ever feel that you're alone when your cat's there?
No.
How about you, Karen? Do you ever feel alone when your cats are at home with you?
No, I love having them there.
Mm-hmm. Well, sure. And one of the hallmarks of depression is loneliness.
Mm-hmm.
And people in depression can know loneliness like no other. And it's very difficult to ignore an animal that's nuzzling you or licking you.
Right.
And can your cat tell when you're sad?
Yeah, she can.
Mm-hmm. How about your animals?
Mm-hmm. Yeah.
Dogs are especially empathetic
Mm-hmm.
with people. When you're hurt or when you're sad or when you're crying, what does a dog do?
Dog will usually come up and lick you or kind of stand right next to you and nudge you, you know.
Mm-hmm. So absolutely. So in closing, Karen, what else do you have to tell us about?
I just looked up a little bit about the different kinds of animals that people use. Cats are a big one as well as dogs. Dogs, if they're specifically being used for therapy, then they're trained to provide kind of an affection and comfort and have a certain personality. Golden retrievers are actually one of the big ones that are seen to be very affectionate and have a very calm demeanor that can help with anxiety and depression and things like that. I also read a little bit about the equine therapy, which is horse therapy, as well as they have dolphin therapy, which can be used as well. Also, I found a study that was done in 1998. This is a little bit more technical, but it was done in a psych ward, and it found that patients with psychotic disorders who participated in animal therapy had twice the reduction in anxiety scores compared to those who just involved in a recreational activity. So I think that does speak volumes about how animal therapy really can help.
Well, certainly. And anything in closing, Ann?
I mean, just like Karen was saying, I was kind of looking into more studies dealing with dementia, but there was, a few that were dealing with schizophrenic patients as well, and they found that the cat and dog therapy improved their overall symptoms, and they were able to engage in more social interactions as well, so it really does have a profound effect.
Well, quite often with schizophrenic individuals, what we attempt to do is do reality checks.
Mm-hmm.
Okay? And there's not much more of a reality than a dog nuzzling against you and licking your
Mm-hmm.
face. And that can certainly bring it up. So I can't overemphasize the importance of alternative type of therapies. Offer what type of enhancements can you have to your life? And I'm going to ask Miss Karen to take us out today.
So to continue the conversation, please like us on Facebook, plus us on Google+, or follow us on Twitter under St. Clair Life, and keep an eye on any of these for our next live recording Mondays around noon to ask your own questions. You can also find this and other grand rounds on youtube.com/St. Clair Video and find audio versions on iTunes, Stitcher, Speaker, and iHeartRadio. And please visit www.stclair.com for more about us and other articles on our great blog.
And also I wanted to throw in that please save the date, on May the 1st of this year, Clair is going to be sponsoring a brain health and wellness conference at the Chestnut Ridge in Blairsville, where we'll be having a number of experts speak on health and wellness, and particularly related to brain health. And as usual, we're going to leave with a free prescription. You're going to be writing prescriptions someday,
Mm-hmm.
will you not? Why, we're going to write a free one today. And that would be fruits, nuts, and vegetables. Perhaps unplug your TV and take up fishing. And for a truly mindful experience, we invite you to fish with odd bait. No expectations. So until the next time, your commitment to yourself and your assignment is to be good to yourself. Until then.